My hip really hurts. I don't think I can go much longer.
You should go see a doctor. It seems like that's been nagging you for a while.
I know, especially like when I'm running or like going upstairs and stuff. Like, it's getting unbearable.
You should definitely go see a doctor then. Let me know what they say.
The hip is a ball and socket joint, meaning it can abduct, adduct, flex, extend, rotate, and circumduct. For these bones to move as easily as possible, there is a layer of fibrocartilage that covers the surface of the joint. The acetabulum has a circle of cartilage called the labrum that seals the joint and stabilizes movement. In FAI, overgrowth of the bone causes abnormal friction in the movement of the joint. These bone spurs can lead to tears in the labrum and degrading of the joint over time due to this increased friction.
The etiology of FAI is quite diverse, as are the populations in which it presents. Within the hip joint, any abnormal morphologies can lead to impingement, most often in the extreme ranges of movement. While hip pain is typically seen in older populations with osteoarthritis, there has also been an ever-increasing prevalence of hip pain within the younger populations, suggesting that there could be a link between sports participation and the onset of FAI. This is most likely attributed to increased levels of activity that can aggravate any existing abnormalities. This in turn is thought to lead to premature arthritis. Some factors associated with the onset of FAI include genetic predisposition, any pediatric deformities or trauma that led to an altered hip anatomy, or high-intensity activity. There have also been studies conducted looking at the combination of genetic risk factors and sports that involve repetitive loading conditions. The specific mechanisms of injury also vary, as there are 3 types of FAI: pincer, cam, and combined. Most notably, pincer FAI is typically seen in older females, whereas cam FAI is more common in younger males.
Hi,
Nice to meet you,
I'm
Doctor.
Dr. Avery. Nice to meet you. Can you tell me what brings you in today?
My hip has been bothering me a lot lately. It hurts a lot when I sit down or whenever I like try to work out or when I run and whatnot.
Can you show me exactly where your pain is?
Right around here.
Okay. Do you participate in any sports by chance?
I do a lot of running and a lot of lifting.
Okay. So I may suspect that you have something called femoral acetabular impingement, but I want to do an x-ray just to double check on that. And in the meantime, we're going to do something called the impingement test, so I'm going to have you lie down if that's okay. All right, I'm going to bring your leg up. I'm going to go out.
Ow!
Okay, back in. Good.
There are 3 different types of FAI determined by the location of bone overgrowth, also known as bone spurs. Pincer occurs when there is bone overgrowth on the rim of the acetabulum. Extra bone extends over the normal rim, which can cause pressure on the labrum to the point of tearing or crushing it. Cam occurs when there is bone overgrowth on the femoral head, causing it to be irregularly shaped. A bump forms on the edge of the femoral head, preventing it from rotating smoothly inside the acetabulum and causing friction with the cartilage there. The final type of FAI is combined. Combined occurs when there is bone overgrowth on both femoral head and acetabulum, leading to a combination of both pincer and cam types. In more severe cases or over time, FAI can lead to tears in the labrum or breakdown of the articular cartilage, leading to osteoarthritis.
Okay, so as we saw in the impingement test, you did have a painful response when I took you through that range of motion, so that tells me that you are pinching in a place where you shouldn't be when you go through that range of motion. So that means that you likely have some sort of abnormality that's causing that to happen. And we also have your x-ray results back. And so as you can tell, there is this bony abnormality here that could be also causing your pain.
Symptoms tend to revolve around pain in the inner hip, groin, or lower back. This pain can happen while resting or during activity. Pain in the groin can happen especially after the hip has been flexed. Other symptoms include feeling a locking, clicking, or catching sensation within the joint, having pain while sitting for an extended period of time, such as in a car, as well as pain when getting up from a seated position. Individuals with FAI may experience stiffness in their thighs, hip, or groin, limping, and inability to flex the hip beyond a certain angle. These symptoms can be chronic and aching or occur abruptly while performing certain movements. Having symptoms can indicate that there is damage to the cartilage.
There are several ways to test for the presence of FAI. An impingement test is a series of movements administered by a clinician to assess for the presence of hip pain during flexion, adduction, and internal rotation. X-rays and CT scans can be done to look for the presence of bone deformities on the femoral head, and an MRI can be done to look for damaged cartilage. There are 2 methods of treatment for FAI: surgical and non-surgical. Non-surgical treatments include modifying rigorous activities of daily living, taking anti-inflammatory medications, physical therapy, and improving flexibility of muscles surrounding the hip. Although all of these methods can help alleviate some of the pain caused by FAI, none of them fix the bone deformity itself. The most common surgical treatment for FAI is arthroscopy. During this procedure, bone abnormalities are shaved down to reduce pain and friction.
FAI was first described by Dr. Reinhold Gans in the mid-1990s. He developed the very invasive dislocation method, which involves dislocating the head of the femur from the acetabulum in order to improve the mechanical function of the individual. It is important to note that FAI is a very common pathology, and people of different ages and populations have some sort of impingement that they either have learned to deal with or typically ignore. FAI is very common in athletes who make sharp movements or cuts with their hips. Unfortunately, many athletes are often told to play through the pain, and FAI isn't typically discovered until the stress and heavy physical activity causes their hip labrum to tear. Some prominent athletes who display evidence of FAI are Gerald Henderson, Luke Kuechly, Percy Harvin, and those mentioned on the slides.